ओके, सो बच्चे हमने प्रीवियस सेशन में देखा, इन द प्रीवियस सेशन वी सॉ द सेल डिराइव्ड मीडिएटर्स. क्या क्या देखा था? वी हैड अ लुक एट द एडिकिडोनिक एसिड मेटाबोलाइट्स, cytokines and chemokines, and vasoactive amines. There were two vasoactive amines, histamine and serotonin. So we had a look at cell derived mediators. अब इसके बाद हम आते हैं plasma derived mediators पे. There are two main plasma derived mediators, that is the complement pathways and the kinin systems. Which was the main kinin? Bradykinin. What was the main role of bradykinin? Pain. Next, we have already seen that. Next, so this starts us with complement systems or the complement pathways. Now, before I even go to the details of the complement pathways, complement proteins bante kahan pe hain? Where are they synthesized? So complement, which it consists of more than 20 proteins. It consists of more than 20 proteins, and these proteins they are synthesized in liver. kahan bante hain? Liver mein they are synthesized in liver. Next point. अब तीन मेन कॉम्प्लीमेंट पाथवे है. there are three complement pathways. The first is the classical pathway. पहला है classical pathway which is initiated by C1, binding with, it is initiated when complement protein 1 C1 binds with antigen antibody immune complex. When C1 binds with antigen antibody, it binds with antigen antibody immune complex. This is the classical pathway. C1 से शुरू हुआ, which binds with the antigen antibody immune complex. Next is the alternative pathway. Second is the alternative pathway. Alternative pathway, this is triggered by microbial surface molecules. ये इसको किसने स्टार्ट किया? This is triggered by microbial surface molecules. It is triggered by microbial surface molecules. अब microbial surface molecules का मतलब क्या है? Examples endotoxin or lipopolysaccharides. Endotoxins or lipopolysaccharides. इन्होंने alternative pathway को initiate किया. It is triggered by microbial surface molecules, that is endotoxins or lipopolysaccharides. Next, तीसरा pathway है mannose lectin binding pathway. तीसरा है mannose lectin binding pathway. Mannose क्या था? What was mannose? Remember, mannose, it was a carbohydrate which was present on the bacterial surface. So when it binds to the complement pathways, the mannose lectin binding pathway is initiated. So तीन complement pathways हैं, classical, alternative and mannose lectin binding pathway. Classical pathway, जब C1 protein, फटाफट दोबारा देखो, when C1 protein binds with antigen antibody immune complex, which is the main antibody? Again, this question is asked, please put a star. Which is the main antibody which is responsible for complement fixation? कौन सी antibody complement को activate करती है? Main is IgM followed by IgG. We will see the same thing in microbiology also. Which is the larger antibody? IgM antibody, it is a large pentameric antibody. बड़ी है, इसके 5 head हैं. So IgM antibody is the one which helps in fixation of the complement proteins. Next point. So these were the three pathways. Let us now have a look at the complement proteins associated with them. देखो, we have already seen classical pathway. It begins by C1 binding with antigen antibody immune complex, which in turn activates C2, C4, and this goes to C3. Then is C5. This in turn goes to C5, in turn leading to the formation of MAC. This is the easiest way. This is actually the easiest way to study the complement proteins. C1 से शुरू हुआ, involves C2 and C4. तो early complement protein कौन से हो गए? C1, C2, C4. C3 पे गया C5 and MAC. What is MAC? Membrane attack complex. MAC stands for membrane attack complex. Membrane attack complex. What is the role of MAC? It plays a role in bacterial cell wall lysis. MAC plays a role. It plays a role in bacterial cell wall. It plays a role in bacterial cell wall lysis. This is the classical pathway. Next is the alternative. Next is the alternative and mannose-lectin binding pathway. We have already seen कि ये activate कैसे होते हैं. Alternative and last is mannose-lectin binding pathway. All three converge at C3. All three converge. All three converge at C3. So I can safely say deficiency of which complement protein will be most severe. सबसे severe deficiency किसकी होगी? Most severe will be deficiency of C3. Very obviously because all the complement proteins were converging on C3. पहला point. Second, early complement protein कौन कौन से हुए? C1, C2, C4. Which are the early complement proteins? C1, C2, C4. Late complement protein या MAC क्या हुआ? What is MAC? It is composed of C5. A या B? C5b to C9 बहुत important है. That is C5b, C6, 7, 8, 9. C5b, 6, 7, 8, 9. That is MAC, membrane attack complex. This was with respect to the complement proteins or the complement pathways. Much more important than this is the role of complement pathways. This gets us to the role of complement proteins. Role of complement proteins. You already know the first 2 points. Which complement is the most potent opsonization agent? Which complement protein is the most potent opsonization agent? C3A, C3B, C5A, C5B. C3B. C3B is an opsonization agent versus which complement protein is the chemotactic agent? Which plays a role in chemotaxis? That is C5A. Opposite मत कर देना. Chemotactic agent C5A. Opsonization agent C3B. Opsonization agent C3B. Next, which complement proteins are the anaphylotoxins? Which are the anaphylotoxins? Anaphylotoxins मतलब they have an anaphylaxis-like reaction. Anaphylotoxins का क्या मतलब है? They cause an anaphylaxis-like reaction. Which are the anaphylotoxins? सारे A वाले, that is C3A, C4A and C5A. All the A वाले. Next, which complement protein plays a role in bacterial cell wall lysis? Which complement proteins play a role in bacterial cell wall lysis? That is MAC, membrane attack complex. And MAC, it is composed of C5b to C9. That is C5b, 6, 7, 8, 9. These are the role of complement pathways. Next point. Another question that is asked from this is the diseases associated with complement proteins. जो हम ये वाली 2 slides देख रहे हैं. Much more important than the pathways are the roles of complement proteins. पहला चीज, the role of complement proteins and the diseases associated. So diseases associated with deficiency of complement proteins. Diseases associated with deficiency of complement proteins. First point, most common defect. सबसे पहले most common से शुरू करते हैं. Most common defect is deficiency of C2. Most common is deficiency of C2 versus the most severe defect versus the most severe. We have just seen most severe is deficiency of C3. Deficiency of C3. Next point, early complement protein defects. Next, early complement protein defects. Early complement protein में क्या क्या आया? C1, C2, C4. Early complement protein defects increase the risk of SLE. They increase the risk of systemic lupus erythematosus. They increase the risk of SLE versus, put a double star, very, very important, late complement protein